Hi everyone, it is my great pleasure to talk about the outcome and challenge of training program for RBI interview and the planning of RBI Plus training in Taiwan. I'm going to talk about development of training programs for RBI interview in Taiwan, then outcomes and challenges of training program for RBI interview. Finally, planning of RBI Plus training. For history of early childhood intervention, ECI has been implemented in Taiwan since 1990s. TACD established since 1996. Family-centered early childhood intervention in medical setting initiated by Taiwan government in 2014. In the same year, RBM started to implement in Taiwan with the support of Dr. McWilliam. Iwan and her colleagues conducted RCT study in Taiwan that initiated RBM implementation in Taiwan. Routine-based early intervention was more effective than traditional home visit program, promoting functional outcomes and reaching family-selected goals. All workshops that Dr. McBride gave to us, we had Chinese text in handout and live translators to reduce the language barrier for early interventionists in Taiwan. The schedule of the fourth workshop demonstrates that Dr. McWilliam introduced RVM model, goals, service model, home visit, classroom visit, and checklist. In 2015, Robin guided Taiwan RBN team to do 5-year implementation plan. Dr. McWilliam also gave a Taiwan mini boot camp in 2015. 7 early interventionists became the training trainer for RBI in Taiwan. These are RBN implementation activities done by 7 RBI trainers in Taiwan, including Chinese translation of Robin's 2 books for preparation, 4 planning meetings, 2 are under Robin's guidance. Many training courses or lectures held by the tech team. We also conducted some studies, publications, and presentations related to RBM. Learning resources are very important. Besides manuscripts, lists for websites are frequently used learning resources. Taiwan team also translate some of the materials into Chinese. For training and implementation, we also to build learning resources in Chinese, especially by Dr. Iwan Huang. For RBI group training, Iwan and Lydia recorded a video to demonstrate how to do RBI. After RBI group training, the participation could apply individual training later to become a qualified RBI interviewer. To train RBI interviewer individually, the trainer usually demonstrates how to conduct RBI with parents in front of the trainee at the first time. During the interview process, the trainer and the trainee completed the RBI report at the same time, and the trainee also read the checklist. Then the trainer and the trainee could discuss further based on the record. After trainer's demonstration, the trainee interviewed at least two parents in front of the trainer in order to get the approval of qualified RBI interviewer from the TechD. Trainee should pass 85% score at least two times. Next, I'm going to talk about the outcomes of training programs for RBI interviews in Taiwan. This is the data of RBI and the related group training activities held by TechD. Words in red color indicate the training given by Dr. McWilliams, others by Taiwanese trainers. Most of the training are two-day workshop. From 2014 to 2020, the TechD organized 20 courses and had amounted to about 3,700 person times. Besides TechD, the 5 training trainers provide more than 120 RBI or RBI Plus training sections in Taiwan. However, only 11 professionals get approval of qualified RBI interview by the TechD. This figure demonstrates that 5 service units and 10 preschools groups in Taiwan started to implement RBI or RBI Plus with the supervision of the 5 trainers since different years and have different progress. We use implementation stages to describe their progress of RBI implementation. The fourth stage is the exploration stage. Second stage is the installation stage. Third stage is initial implementation stage. And the fourth stage is full implementation. After 2 to 5 years, all of them reach the third initial implementation stage at least. St. Teresa Opportunity Center started to explore the application of RBI in 2015 and progressed to full implementation in 2018. Zhanghua Nonprofit Preschool in Taichung City started to explore the implementation of RBI in 2019 and progressed to full implementation within 2 years. The 3 driving forces of implementation science and community culture are the keys. However, if we look at the whole Taiwan, the implementation of RBI or RBI Plus is still at the first or second stage of implementation science. And at the TechD annual conference, we have 21 RBI or RBI-related presentations. However, from the Google, no RBM academic articles reported in Chinese. In our recent publications, we did introduce RBM concept in it. For example, in the handbook of the community-based childhood early intervention, RBM is mentioned 47 times, and in the book of assessing mastery motivation in children using the dimensions of mastery motivation questionnaire (DMQ), RBM concepts mentions 4 times. This is the recent presentation in the World Physiotherapy Congress 2021 to demonstrate how we implement RBN in National Taiwan University Hospital. I also do my best to introduce RBN to the public through different media, such as introduce one article that apply RBN in COVID-19. In one recent pediatric physiotherapy textbook, a lot of RBM strategies and materials are also introduced, including PSP, CSP model, and the next step form. Now let's move to challenges of training program for RBI interviewers in Taiwan. It could be classified into three levels: police system level, service unit level, and personal level. For example, at the police system level, although the family-centered early intervention policy is promoted by government, the service units, service providers, and the family of children with developmental delays have not yet fully understood and accepted the family-centered approach. There are many models of the family-centered early intervention. Various professions and organizations are promoting different family-centered early intervention models. The effectiveness and advantage of RBN over other models are not recognized. It is difficult to persuade the leaders of the service unit to use RBI or RBI Plus as the key service strategies. The third one, uh, Taiwan government promotes early intervention services has been more than 30 years. The areas of medical care, social welfare, and the educational system have their own system model. The process and the record format of RBI or RBI Plus cannot be integrated into existing systems, especially the medical and the education systems. The RBI progress and the record format may be different from the individual service plan and regular application requirement of the current systems. For example, the ECOMAP format of the RBM is not accepted by the Taiwan Social Worker Society. At the service unit level, the understanding and the recognition of RBM among leaders of service units needs to be enhanced. There are still many challenges for integrating RBI Plus process into the tight and standardized service schedule of current organizations. At the personal level, there are three challenges. First one, the mental state of service providers must be changed, and the technical assistance and organization support are needed for service provider to get a sense of accomplishment from the RBI implementation. The implementation of RBI or RBI Plus in rural areas for high-risk families or for children with multiple and severe disabilities faces greater challenges. The competence of service providers to implement transdisciplinary models such as PSP or CSP needs to be enhanced. Another challenge is the qualification of RBI Plus implementer. Standard of qualified RBI Plus implementer is what? And how to use the certificate of RBI Plus implementer is another question. And the RBI Plus certification announcement at TechDing not decided yet. Last, I will introduce the proposed planning of RBI Plus training in the future. This is the tactic schedule of workshop preparing for RBI Plus individual training this year. There are a lot of family-centered early intervention workshops offered by other organizations. Therefore, TechD focus more on one-day RBN introduction course. It could be physical or online training course. In the workshop, preparing for RBI Plus individual training, content include RBM introduction and RBI Plus simple practice exercises, small group discussion and practices with the support of a lot of RBI Plus facilitators. We use this figure as a guideline to introduce RBM. At the beginning, need assessment of planning, that's the RBI Plus, then the service model, including primary service provider and the CSP, then the collaborative consultation, including the different routine-based visits at home, classroom, or in clinics. And talking about the early intervention is the caregiver implemented intervention, and then the outcome emphasize the family confidence and family quality of life questionnaires and GS for the goals, especially measure the engagement, independent, and the social relationship in routines. The content of RBI Plus training include ECHOMAP, RBI, goal setting, and goal routine matrix, and GS. This is the one-day RBI Plus preparing workshop in this March, and we'll do that again in this September in Taiwan. Not only lectures, we emphasize more on group discussion and simple practice exercise, such as design, participation-based goal, family goal, and goal routines matrix, etc. For introducing ECHOMAP, we do not only explain what it is and how to do it. We also give the practical information in the field. For example, we will tell participants that it takes about 10 to 15 minutes to complete the ECHOMAP with family. For introducing RBI, we will explain the differences between full RBI and the review RBI and the timing to apply these two types of RBI in early intervention services. According to our experiences, full RBI needs about 1 to 2 hours, and the review RBI may be just 1 hour. This is the example of participation-based goal with goal attainment scale, GAS. To complete the 10 to 12 participation-based goal and family goal with GAS needs about 1 to 2 hours. The first column is the priority of goals selected by parents. Second column is the description of participation-based goal. Third column is participation-based goal designed by the team. And fourth column is a description of 5 scale goal of GAS. For example, -2 indicates same or worse than chart baseline status. 0 means expected outcome performance of that goal. +2 means much better than expected performance of that goal. This is a completed goal routines matrix. Service provider need to spend 1 more hour to complete it. Let's take a look at the matrix. The fourth column is also the priority of the goals selected by parents. Second is the name of PSP, CSP, or providers in charge of that goal. And third is a brief description of the goal. Then the routine of the family and the chart. The number at the bottom row are possible practice number in each routine, and the rows at the right corners are possible practice number for each goal. This is RBI plus individual training procedure. First, the trainer demonstrates and the trainee observe and take record by sight. Then the trainee interviews with parents and the trainer observe and rate the checklist. Afterward, they will discuss components of RBI Plus online or face-to-face. These are the references if you are interested. Thanks very much for your attention. Let's move to the topic 3.